team. How is everybody doing?
Good.
Yep. All right, so we'll have a small huddle today.
Yes.
This is just in preparation for any resuscitation that might come through our doors. Okay, so Rana, you'll take care of the airway today.
Sure.
Angie, you'll take care of circulation.
Sounds good.
And Wangoi, you'll take care of any intravascular access that we would need.
Okay.
Get ready for calculation of any of the drugs or anything, or any communication that we have with our external teams. Is that all right? Are you ready for today?
Sure.
Let's do it.
There's a 6-year-old boy who has been brought into the emergency department by the parents. And in the background history, this was a boy who was previously well, but he woke up the previous night after a few hours of fever and also vomiting. And then this morning when he woke up, he basically was unarousable, had a widespread non-blanching petechial rash all over his body. So as you approach the boy, you can obviously see that the child appears to be floppy. He's blue and has mottling of the skin. Okay, so you want to repeat the SBAF?
Okay, thanks, Isaac. I'll just repeat that. So we had a 6-year-old boy who has been brought into the casualty by his parents.
Yes.
He was previously well last night, but sometime in the middle of the night, he had some vomiting and some very high fever, and then became unarousable.
Yes, with widespread?
Blanching rash.
Yes, non-petechial blanching rash.
On examination in our unit, he appeared mottled. He had a mottled skin, widespread non-blanching rash,
Yes.
and some blueness around the lips.
Yes.
Okay, great. All right, so I'll just ensure my safety. I've got my mask on. I'll put on my gloves. So I'm safe. Is it safe to approach the boy?
Yes, there's no obvious hazards around there.
Okay. I'll just come. I'll stimulate. What's his name?
His name is John.
John.
John is completely unresponsive.
Okay, so team, I need some help. We've got a patient who is unresponsive.
Okay, so the team comes in.
Okay. I'm going to look into his airway, putting him in a sniffing position. Is there anything in the airway?
There's no body.
Okay, I'm going to look, listen, and feel for breathing for not more than 10 seconds.
Okay.
Is the child breathing?
No, child is not breathing at all.
Is there any chest rise?
No chest rise.
All right. I'll go quickly and give him 5 rescue breaths with a bag mask ventilation, ensuring good chest rise. 2, 3, 4, 5. Rana, can you continue that for me? Continue bag mask ventilation at a rate of about 20 per minute. Okay, I'll just ensure that there's good chest rise.
Okay, so you can see good chest rise.
Okay. I'll auscultate and look for air entry bilaterally.
Yes, there's good air entry, both sides, with the bagging.
Okay. I'll just connect him to an SpO2 monitor. Okay. What's my saturation?
Your oxygen saturations are 90% and thereabouts.
Okay. So Rana, continue that. Okay. I'll move on to circulation. I'll check a central pulse. Is there a pulse?
There's no pulse.
No pulse at all. Okay. Angela, please start chest compressions. Okay. I want you to go at a sync mode of 15 to 2.
Okay.
Okay, while you're doing that, I will attach the monitor.
Okay.
Okay, I'll just increase the gain for that. Okay, Angela, can you just stop while we assess the rhythm? I'll check a pulse at the same time.
There's no pulse.
So there's no pulse. We have a rhythm. It's a rate of 72, but with no pulse. This is a PE.
Yep.
Okay, so please continue chest compressions at a rate of 15 to 2. Wangoi, I'll need your help now.
Okay.
Can you get for me an intraosseous access as soon as possible?
Yes, sir.
Just let me know once it's done.
Intraosseous access.
Fantastic. At the same time, just take some blood samples. Let's do a full septic screen.
Blood sample taken.
A random blood sugar as well.
Sent to the lab.
Okay, just flush the line.
Okay.
Okay,
Line flushed.
well done. Now, since we had no pulse with the electrical activity, I think we need to give our first dose of adrenaline.
Yes.
All right, so Wangoi, what is the weight of our child?
20 kilos. So I'll be giving 2 ml of 1 in 10,000 adrenaline.
Okay, well done. Let's give the first dose of adrenaline and just follow that with a flush of 10 mils of saline.
Adrenaline given and flushed.
So 2 minutes is almost up.
Okay, so we'll continue the CPR until our 2 minutes are up. Okay, so the 2 minutes are up. Okay, I'll just stop the team just to check. So I'm looking for the pulse as well as the rate.
Okay,
So is there a pulse?
no, there's no pulse.
So no pulse, and we don't have any activity on our monitor. Okay, so we're in astel. Angela, please continue with chest compressions at the similar rate of 15 to 2. Okay, so at this point, I mean, why don't we consider some of our reversible H's and T's? What do you guys think? We had a 6-year-old boy. He had some vomiting at night with fever as well. What do we think? Volemia?
Electrolytes may also be a problem. Hyperkalemia.
Yeah, I agree.
Anemia. Temperature-wise, I'm not sure what we're doing.
Okay, he also had a rash, all right? So why don't we give him a bolus of 20 mils per kilo of normal saline, thinking about hypovolemia. Okay, so Wangoi, I'll leave you to that.
Yes, I'll put 20 mils per kilo of normal saline, that's 400.
Okay, so let's give that as a bolus.
Bolus started.
Okay, so bolus given. Okay, so after 2 minutes, I'm going to stop you, Angela. Okay, I'll just quickly reassess.
Okay, so there's still no pulse.
So no pulse, still no activity, so we're still in asystole. Please continue. Wangoi, I think we need to get ready with our second dose of adrenaline.
Okay, I'm preparing 2 mils of 1 in 10,000 adrenaline and a flush.
Rana, at the same time, I think we need to get some definite airway. Maybe we can get in touch with the PICO team for somebody to intubate the baby. Okay, second dose of adrenaline given.
Second dose of adrenaline given and flushed.
Thank you. So let's continue CPR for 2 minutes. Okay, 2 minutes are up. I'll stop you. Okay, so is there a pulse?
Yes, you can feel a pulse now.
Oh, there's a pulse, okay. There's a rhythm on the monitor as well. It's a sinus rhythm with a rate of 72 per minute, so that's fantastic. Okay, well done, Angela. I think I'll stop you there. Okay, so I'll want to reassess the baby now. So, Rana, let me have a look at the airway. In a sniffing position, anything in the airway?
No, the airway remains patterned.
Okay, I'm going to look, listen, and feel for breathing. Is the baby breathing?
No, there's still no breathing.
Okay, is there any chest rise?
No chest rise.
Okay, Rana, please continue that while we wait to intubate. What's the saturation?
Oxygen saturations are now around 98%.
Okay, so Rana, let's continue that. I'll go to circulation now. I'll check the pulse again. Do I have a pulse?
Yes, you have a pulse.
With a rhythm at 90 per minute, which is sinus, that's good. I'll go to the other parts of circulation. I'll check a cap refill.
So 1001, 1002, 1003, 3 seconds.
So 3 seconds. How are the extremities?
Extremities feel a bit cool.
Okay, can I get a blood pressure as well?
Blood pressure is about 55, 35 millimeters of mercury.
Okay, so that's low. Wangoi, I think we'll consider a second bolus now. Our blood pressure is low. We have a delayed cap refill. Give another bolus of 20 mils per kilo, please.
Okay, 400 mils of normal saline going in.
So while that is going, I'll move on to disability. Do we have our random blood sugar back?
Yes, it's come back. It's about 8.3 millimoles per liter.
All right. Rana, let me just check the pupils. How are the pupils?
Pupils are equal and reactive,
Is the baby responding to pain or to touch?
just to pain.
Okay, I'll fully expose the baby now. Any rash on the body?
Yes, there's a widespread non-blanching petechial rash.
Or what's the core temperature of the baby?
It's about 38.5.
38.5.
Yeah.
Okay, team, what do we think? I mean, we had some features of sepsis that we were thinking about, hypovolemia. With that rash, what do you think? Yeah, probably, right? So, Wangoi, I think I'll keep you in charge of that. Let's give our first dose of antibiotics. Okay, let's take ceftriaxone, thinking about meningococcal sepsis, at 100 milligrams per kilo.
Okay.
Okay.
2 grams of ceftriaxone being given slowly.
Okay. Then once that is given, I'm going to reassess now.
Ceftriaxone given.
Okay, well done. Okay. All right. Mary, you're from the PICU team? Okay, thank you for coming. We have a young boy here. He was 6 years old. He was brought into our unit with a history of some vomiting and poor feeding. He appeared cyanosed, mottled with a rash. On examination, he was in respiratory failure. We had to give him some bag mask ventilation. He also had a cardiac arrhythmia. He had no pulse. With some electrical activity, we were thinking about a PEA. So we immediately gave him some chest compressions. We had to give him 2 doses of adrenaline. He also had some decompensated circulatory failure, so we also gave him 2 doses of normosaline at 20 mils per kilo. He's stable at the moment with a sinus rhythm at a rate of 90 per minute. However, I think we'll need to intubate this child.
Okay,
Thank
so
you.
I'll stop the scenario there.